This brings us to the final portion of this part of our day. And I'd like the panel to come up, Pam Cipriano, Barry Rubin, and Annalise Silva. If you could come up, that would be great. Oh, and Eric is here too. Oh, he's not on my list. Eric, you are not on my list. Okay, we got. You're watching the sausage be made up here for a second. The lists have changed substantially. Okay, now let me start over, right? I'd like to bring up our panel, Dr. Eric Wee, Dr. Jennifer Kennedy, who is online, Dr. Annalise Silva, and Dr. Pamela Cipriano. Did I get everyone right at this point in time? And what we're going to do is focus today, and we have actually a limited time. We're going to go beyond 12:15, so those of you who have a physiological need, either input, there's some food out there, or output, there are men's and women's rooms out there. If you could just take your time to do that. We're going to talk about moving forward and what to expect this year. And these are organizations and people that have been around for a long time in our collaborative. Pam Cipriano is the president of the International Council of Nurses, and she's going to speak to the steering committee's discussion on how far the collaborative has come. Dr. Annalise Silva is going to talk about, she's really dear to my heart, even though we don't know each other very well at this point, because I spent my whole career with learners. And there are some old heads like me up here who maybe opened the door a little bit, but the future sits with her. Because I'm just getting the information of the last two, I do not exist, so I'm going to be surprised as much as you are about what Dr. Eric is going to be talking about. And let me see if I've got this all right. And Dr. Jennifer Kennedy will be talking about. But these are people that have been involved with us for a long time. Even Annalise's organization has been involved from the beginning. So I'm going to turn it over without much further ado to talk about what we're looking about is moving forward. We talked a lot about what we've done. We've talked about the inspiration to move forward. But now we're going to get to some of the hows and whys and what's we're going to do. So without much further ado, I'm going to turn the first part of the panel discussion over to Pam. Pam, please.
Thank you, Tim. And thank you for everyone being here as part of this discussion and this movement. I wanted to reflect on something that was said by Vivek, which is we have changed the conversation about well-being. And I think that's truly attributed to the work of this group. So I was one of the original people, which is now like 7.5 years ago, as have many have been, that were called together because we were concerned about burnout. It was almost a singular issue of how do we prevent burnout, because we understood that the health workforce was really struggling. But really, what we obviously had to do was to move from that agenda in 2019 and 2020 to recognizing that the pandemic now had blown open all of the wounds and all of the problems that we were seeing around well-being in many other realms. And the national plan that now many of you have been able to pick up a copy today, hopefully you'd read a lot of it before, was really an effort to say this is an all-of-society approach that's needed to address this issue. It's interprofessional. It's all of government. It's all of healthcare organizations. It is a multifaceted problem that requires a multifaceted and multi-organizational response. And so the national plan really has helped us to set the stage and again, part and parcel with other collaborators, such as the Dr. Lorna Breen Foundation and the work that Corey and colleagues were able to do in order to have the Lorna Breen Act passed, which it has had a monumental influence. We also saw groups come forward that said it's time to really look at joy in what we're doing. Joy was not even considered a word that we would think about in healthcare. So again, changing this conversation to look at what's important and how do we reframe our belief in terms of well-being. The other thing I would say is a contagious passion, and I think we heard that just now in the accelerators, that this is a time that we have seen the movement grow to something where people can be really proud of saying, well-being is important, and we're not going to ignore the mental health stigma. We're not going to ignore the fact that we shouldn't feel like having oppression in the workplace is part of the job. We've changed education. You know, I think back to the traditional roles of things like the morbidity and mortality conferences, where the goal was to make people feel bad because they had made a mistake or they didn't know the answer. To be able to say, no, this is really a learning opportunity because our goal is not to make people feel bad, but it is to enhance learning. It's to make improvements. We also know that it's been important to move from awareness to action. And again, I think the collaborative has been really critical in saying it's not just enough to have these messages, because we've moved from individual responsibility for well-being to organizational and whole of society. I mean, again, probably everybody here can remember when we first started talking about this, and it was like, okay, you must be resilient. Well, everybody is resilient, and then resilience became a four-letter word because it almost seemed like that was the sole response to preventing burnout, to addressing the mental health issues, the fatigue, and the recovery from the pandemic. So again, really significant movement. The work that's been done in terms of the licensing examination and credentialing, removal of threatening questions. I mean, again, monumental work, and I credit Corey and the Lorna Breen Foundation for that movement that is continuing to now address other professions as well. Some of the change-maker work, again, we're just beginning to see the results of that, but again, that brainstorm, and Anna's leading that group as we think about how do we take even some of the smallest operational changes that have been problematic and difficult for people and say every step we make toward improving the impact on the work of all of our professionals, on our entire workforce, are really important, because that's one more way to chip away at the barriers to well-being. So overall, I think we can take great pride in not only the work that was pre-pandemic, because I think we sort of have this line in our mind of what was pre and what was post, but this is a long-term set of solutions to be able to take action on recognizing that the work that we do in healthcare is not for the faint of heart. The work that we do in healthcare is compassionate work. It is work that will always tax us in an emotional way, in a physical way, in a mental health way, because whenever we're exposed to any kind of traumatic experience, whether that's, again, sort of a psychological issue or a physical issue, that sticks with us. And so many healthcare workers, and more so the clinicians, experience that on a day-to-day basis. And now we have said it's really important to make sure that we help everyone in that universe be able to experience joy, be able to heal, be able to have that resilience, to be able to look to the future and say, I will be able to enjoy what I do. I will have the supports. If I need a break, I'll be able to get a break. If I need professional help, I'll be able to get professional help. And it won't be stigma, and it won't be a black mark on my career, and I won't have to worry because I can now do the work that I chose in order to be able to help others. So I congratulate all of you for the work you're doing and want to thank everyone who's been involved in the collaborative, because I think we have shown great progress, and this will only continue to strengthen in the future, given the work of so many groups that are really committed to the activities that, again, are making the national plan actually come to light.
Great, thank you. I'll turn it over to Dr. Eric Reed. He and I actually met in the men's room this morning, tying our ties. Dr. Wee, again, who is the Chief Executive Officer in New York City Health and Hospitals at Bellevue. Your remarks.
Thank you so much, Tim. I feel like maybe like a CIA spy infiltrated this panel the same way as a wellness champion that infiltrated the ranks of CEOs. And so I always feel like I need to apologize on behalf of all CEOs, health systems, and hospitals for difficult conversations and barriers that might have been put up. But Anne asked me to talk a little bit about the progress of our well-being programs in New York City Health and Hospitals, as well as the perspective of a CEO. What it'd be like to, what's the best way for wellness champions to have those conversations? And so, if you've ever seen those social media, how it started and how it's going, I'm going to kind of frame it that way. And so, 10 years ago exactly, I got plucked out of the emergency department at LA County USC by the CMO, who said, "You're going to come be my deputy CMO over quality and patient safety, and part of your responsibility is to run RCAs." And having never attended an RCA, not knowing what an RCA stood for, I went to Google and I typed, "How do you run an RCA?" Right, a root cause analysis. And so for those who don't know, this is what we do when there's a difficult case and you want to get to the root causes of what allowed this case to happen and try to prevent recurrence. But my first couple RCAs, I left that meeting with a pit at the bottom of my stomach. There was something wrong. We were bringing nurses, residents, attendings to tears about a nightmare case that they've not been eating, not been sleeping about. And after the hour and a half, we pat them on the back and say, "Go to the operating room and do perfect surgery. Go to the ICU and hand out medications perfectly." And I knew, they knew, everyone in the room knew they were compromised. There was no way they were going to be able to do that. And so this pit in the bottom of my stomach was, we got to be able to do something more to support our staff. And then once that veil's taken off from the culture of medicine, then as I was working in the emergency department, right, we lose a trauma case. Everyone just scatters. There's not even acknowledgement that a life was lost and that this might have impact on the medical student, the nurses, anyone that was in that room. And so I started, seeking, is there a national plan? Is there a blueprint for me to follow to be able to support our staff? And there really wasn't. There were a few kind of bright spots, right? Susan Scott at University of Missouri, Albert Wu at Johns Hopkins, Joe Shapiro at Harvard. And so really using QI, I was the chief quality officer, we had to build it from the ground up at LA County. And we created the Helping Healers Heal program. The whole idea was the culture of medicine made it impossible for us to turn our healing powers that we give to patients and their families all day, every day, towards each other, right? Nurses eating their young, the attendings who told residents they walked uphill, barefoot, in the snow, both directions, right? Worked more hours than there are in the week. What do you have to complain about? And so we created this program from the ground up, based off of peer support, providing emotional and psychological support for second victimization. This spread across LA counties, 3 public hospitals. And actually in 2017, when Dr. Mitchell Katz took the job at New York City Health and Hospitals, he was going home to turn around the nation's largest public system. He asked me to come with him. And for my first meetings, I remember debriefing with him over wontons in Chinatown in New York City. He said, New York City needs H3 even more than LA does. And so from the very beginning, we said, we're not going to come into this system that had a $1.8 billion structural deficit, it was in this death spiral, and tell them that we're going to squeeze more out of the workforce. We're actually going to bring the workforce something that was a bright spot from LA. And so how it's going today, we were able to launch 18 H3 programs across all hospitals, skilled nursing facilities, and service lines pre-COVID. It rapidly expanded through COVID. We actually, through Project Hope, spread H3 principles to 40 different countries and over 100,000 healthcare workers trained. We've expanded it from a second victim program to a comprehensive wellness program. So now we have a system inaugural chief wellness officer, Jeremy Siegel. We have wellness directors at each of our sites. We're now implementing more chief wellness officers at individual hospitals. And we're seeing culture change from that. And so I would say as a CEO, I kind of came to it from a quality and a wellness background, really, keeper culture. We have it as part of our strategic plan dashboard for our board. It's what our president CEO is graded upon each year. So a lot of the things that the first panel talked about, we have. But there's still work to do, right? Now over 90% of our staff are aware of H3, but still only 51% said that they feel comfortable individually and proactively utilizing H3 services, right? And so there's still definitely stigma and work to do. But my advice would be something that Corey talked about in the first panel, is that each CEO is different. You know, their background, did they come up as a CFO? Did they come up as a CMO or CQO or COO, right? What are their goals? What were they being asked to do? What are they being asked to do by the board? Is it a turnaround? Is it a transformation? Is it keep things going? Because, right, finances are gravy. We just want this train to keep going. Figure out what it is that your CEO cares about, what their vision is, what their board is asking them to do. And so for me, I think about it, right, you can make a case for any of our 5 strategic pillars: quality and outcomes, right? Staff who are well and taken care of and have psychological safety are going to provide higher quality and safer patient care, right? Access to care. If you don't have a doctor or a nurse or anything, right, you could, I often think about the OR. If you pull one part of that out, you're still paying everyone else's salary, but you can't do the surgery. You can't do it without the anesthesiologist. You can't do it without the scrub nurse, right? And so you are reducing access to care with burnout and turnover, right? Financial sustainability, right? It's incredibly expensive to replace physicians and nurses, right? Culture of safety, right? If they're not willing to raise their hand and tell you what's happening, how do you know what to make better? And then the care experience, right? Everyone knows if they're being treated by somebody who's burnt out. They also immediately can tell if somebody is well and enjoys their work, is finding joy in their work. And so I'd say it's really find kind of which of those strategic pillars you're most aligned with your CEO and have that conversation, as well as the board, right? I agree with that.
Thank you, Eric. Insights from Jennifer, who again is the 38th president of the American Nurses Association. Jennifer?
Sorry, it's really hard to hear, so I'm assuming it's my turn. Yep. So it's an honor to speak with you today, and good afternoon to everybody, about a topic that's never been more important: nurse well-being and all clinician well-being. And over the last few years, we have witnessed a significant shift in how well-being is prioritized within the nursing profession and in all areas in the United States. And the challenges of the COVID-19 pandemic, ongoing workforce shortages, and rising levels of burnout have forced healthcare institutions and policymakers and communities and associations to take action. And today I want to highlight some of these key developments and well-being initiatives for nurses and all clinicians and physicians, and why this progress is crucial for the future of healthcare. Nurses, as all others, have faced increasing workload demands, long shifts, emotional and strain. The work of healthcare providers is inherently stressful. And so in recent years, these pressures have intensified, leading to alarming rates of burnout, stress, mental health struggles. Studies have shown that nurses' burnouts have reached unprecedented levels, with many experiencing exhaustion, moral distress, and even leaving the profession altogether. And recognizing these challenges, healthcare organizations and policymakers have begun prioritizing well-being programs in a way that we've never seen before. Through the Action Collaborative on Clinician Well-being, we have focused on raising awareness, understanding challenges, and advancing solutions. And through this, I have watched one of the most significant shifts, which has been the acknowledgement that well-being is not just a personal responsibility, but an institutional and systemic priority. There are several key initiatives that illustrate this growing commitment. First, mental health and emotional support programs. Many hospitals and healthcare systems and associations have established dedicated mental health resources for nurses and all others. Employee assistance programs have expanded to provide confidential counseling, stress management resources, and peer support groups. For example, the American Nurses Foundation launched the Wellbeing Initiative, which is offering free resources such as therapy support lines and mental health apps tailored specifically for nurses. When it comes to legislation and policy changes, the federal government and various states have introduced policies aimed at improving work conditions. And it cannot be overstated the work of the Dr. Lorna Breen Healthcare Provider Protection Act and that foundation, which is a landmark moment for the work that we are doing. Third, workplace wellness programs. Many healthcare institutions are now implementing holistic wellness programs that focus on physical and emotional well-being. Some hospitals have introduced initiatives such as flexible scheduling, designated wellness spaces, and on-site mindfulness programs, as well as resilience training workshops. The American Nurses Credentialing Center has introduced the Wellbeing Excellence Credential, which is aimed at recognizing healthcare organizations that prioritize and effectively implement well-being programs for their staff. And fourth, technology and innovation. The role of technology in nurse well-being has also been expanded, and there's a better focus on how AI can not only enhance clinical decision-making, but how it can allow nurses to focus on direct patient care more and less on repetitive tasks. Additionally, AI-powered wellness apps and virtual mental health platforms offer personalized stress management tools, guided mindfulness exercises, and confidential support, helping nurses prioritize their own well-being. These initiatives are already making a difference. Studies have shown that nurses with access to well-being resources report lower stress levels, increased job satisfaction, and improved patient care. And while progress has been made, there is so much more work to do. We must continue to advocate for policies that prioritize well-being, expand access to mental health resources, and foster a culture that values self-care as much as patient care. So in closing, I want to emphasize that investing in nurse well-being and all clinician well-being is not just about improving the lives of healthcare professionals. It's about strengthening our entire healthcare system. A well-supported workforce leads to better patient outcomes, stronger healthcare institutions, and a more resilient profession. The progress we've seen in recent years is just the beginning, and together we can ensure that nurses' well-being remains a top priority for years to come.
Thank you, Jennifer. Thank you very much. And last but certainly not least, and I did leave you for last because you bring it together. One of the things that all of us, I think, who have been here for a long time, we've seen the rhythms of paying attention to whatever they want to call well-being, stress, well-being, burnout. Over the years, over 100 years, go up and then go down, go up and go down. So from your perspective, how do we keep this train on an underailable track?
Oh, I don't know if I have all the answers to that one. I wish I
In 5 minutes.
Right, exactly. No, I'm really excited to be able to chat today and to share a little bit more about the trainee perspective. And I think it's also funny that I'm having this conversation with all of you today because today's not St. Patrick's Day in my world, it's match day. And I've got an email waiting in my inbox that I will not be looking at until lunch. So, but I think when we're talking about the trainee perspective when it comes to progress and well-being, I like to think of it from a generational approach because right now in my world, I'm looking at millennials, I'm looking at Gen Z, and I'm looking at Gen A coming down the pipeline. And I think it's important when we're looking at it from a generational perspective in terms of what are the values and what are the expectations that these trainees are bringing to the field. And so for these different groups, I think one of the biggest things is wellness. These are things that we are talking about in our personal lives and in our professional lives when we're allowed to. And so these are things that are something that's very common to what we're having. But we often don't have the guidance, and we also don't necessarily always have we don't often feel like we have the support to be able to have those conversations. And I think, the term cancel culture is often facetiously associated with the younger generations, but I think it's really indicative of what we can anticipate for future providers coming into the space, and that's that these future trainees are well connected, they have a voice, they're willing to use it for better or for worse, but we do need that guidance to be able to articulate themselves. And I bring this up because even as far as my class, my medical school class of 2024, we're now ushering in a generation of physicians who have only ever known medicine professionally in the wake of COVID. And so we see the burnout, we see this increasing mistrust of the public in medicine, we see the questioning of science in the government, we see the threats to practice for those practicing in certain specialties, and it gives us that pause. But I think that the bright point that comes out of it is exactly this space and these conversations and all of you doing all of this work. I think the biggest marker of progress for well-being in the trainee space is the environmental change, is the willingness to have these conversations, because we're already having them. But if we don't feel safe to be able to have these conversations and are at the table and able to share our perspectives, it then becomes this something that we have to dig deep into ourselves, hide it, and that's where you see this kind of spiraling place for students that they're burning out earlier and earlier and earlier. As case in point, my sister is a sophomore in college and she is panicking about getting into medical school. She doesn't think that she's doing enough, and she has to juggle, do I sacrifice my grades so that I can do something more impressive, or is just studying enough? And so I think that on the other hand, I think another bright point is the focus on this is a really exciting time in medical education. Because of all of the things that are happening currently, there's been this bigger shift into looking at how do we train our trainees in a way that centers wellness? How are we making these curricular changes that build in the sustainability of our students and then by proxy our patients? And so I think that all of these together build this cultural shift towards centering wellness that I think is really the keystone of what we can see in terms of the longevity of the field. But I'd be remiss to say that everything is hunky-dory in the trainee realm. I think that there is still a lot of space, and it's still a little bit of a precarious place to be a student these days in any of the healthcare fields because of these different questions. And I think that if we don't continue the work that we're continuing to do and dive deeper, that we run the risk of exacerbating the care shortage that we're acutely feeling now. And so it's important for me to take a second and echo all the gratitude and all the thanks for everything that everybody's doing. I know as a former educator myself, teaching can be a thankless job sometimes, but I think it's really important to thank you all for that work and the intentionality that you're bringing to it, because being able to bring us to the table, including our thoughts, including our perspectives, it helps us work with all of you to help change the narrative, where medicine doesn't have to be a place where we eat our young. It can also be a place that we are celebrating and supporting and being able to promote for the future of ourselves and our patients.
Thank you.
So we have just a little bit of time left, and what I'd like to do is, you've all heard what each other has said. If there's something, 1 or 2 or 3 sentences, and that's about it that we can do, that you'd like to say that would wrap this panel up and actually wrap this section of the day up for you, what would it be? And I hate to do this, but I'm going to start with Eric.
All right. I mean, I think it's just amazing that we have this Health Workforce Wellbeing Day, that we have this national plan from the NAM Collaborative. What I like to see is this to infiltrate all of healthcare, right? Every hospital, every FQHC, every skilled nursing facility across. And then the other thing I like to see is that the value that's placed on wellness is taken into account of who's being selected to be on boards and who's being selected to be C-suite, leaders. It's until we infiltrate that completely that wellness still runs the risk of being something extra.
Thank you.
I want to pick up on something that Eric said earlier, which is I believe we have seen culture change and are continuing to see culture change. We've talked in previous session about leadership, and those two things together I think are really critical in how we're going to be able to continue to make progress looking ahead. I also think Annalise's comment about the generational expectations are also critical. That's part of culture. And so I think we can take away some significant optimism that not only is it the dedicated work and passion of everyone involved in the collaborative and all of our organizations that we're influencing, that we're trying to get this movement to become a contagious, action-oriented plan around the country. But I think we can take stock in the fact that we are seeing a difference. And maybe it's the urgency. Maybe it's the fact that so many of our healthcare organizations woke up to the labor issues and said, wow, we're not going to keep a workforce. We're not going to attract a future workforce unless we change. And one of my favorite T-shirts that I've hung on to for years was a Dilbert expression that said, change is good, you go first. I think we're past the first now, and so I would see us for the future really being able to focus on momentum and keeping this going, continuing to make great progress.
Great, thank you. Annalise?
Sure. I think that for students, I think it's important that, one, again, we celebrate and please continue that work in bringing students to the table. And when you're looking at your metrics, I recognize that students aren't always the most financially beneficial stakeholders in the space, but I think that there is often need to probe into whatever your metrics are coming in from students a little bit more, because students often are feeling like they're at the bottom of the totem pole in terms of power, and they might not always give you what they really, really feel. So bringing in that representation to the table is really, really critical so that you can hear multiple perspectives. But thank you for all the work that you do.
Annalise. And Jennifer, you can bring us home.
Thank you. What gives me hope about the future of well-being is the growing recognition that it matters, not just for nurses, but the entire healthcare system. And the shift towards prioritizing holistic well-being, mental, physical, and emotional, gives me confidence, and listening to all the work that we have talked about so far today, that the future will be one where everyone are valued, supported, and empowered to thrive.
Great, thank you. Give this panel a round of applause, please. We've heard the whole day, and we're going to continue on this, is what my friend Bryant Adibe says, is weaving well-being as a value and not seeing it as a problem to be solved is really important. And that this is an act of love, and there's a guy named Sternberg that studied love. And what he says is love is three things in equal portions. It's intimacy, passion, and commitment. Intimacy is that desire to be close to one another and close to whatever it is you love, which is, in this case, is patient care. It's the health of the public. Passion, you know what the Latin root for passion is? It's to suffer. You're willing to suffer to do this work so that the next generation has a different feel than this generation does. And commitment is when those other two things aren't there, that mainly wives probably with their husbands, if they or significant others. You have that commitment, I'm going to stay with this human, I'm going to stay with this here. So I want to read to you one quote that was sparked by Pam and the others about what joy really is versus happiness. And that's what we're trying to do. This is from Desmond Tutu. Desmond Tutu, again, was an anti-apartheid activist. And what he says is, discovering more joy does not save us from the inevitability of hardship and heartbreak. In fact, we may cry more easily, but we will laugh more easily also. Perhaps we are just more alive. Yet as we discover more joy, we can face suffering in a way that ennobles rather than embitters. We have hardship without becoming hard, and we can have heartbreaks without becoming broken. So for this, I'll stop with the Dr. J analogy. What Carlton reminded me, when Dr. J first came on board, people said, that's not the way basketball is supposed to be played. You're not supposed to jump off the ground like that. That's what we faced when we first talked about well-being. Remember, this isn't what medicine, this isn't what nursing, this isn't what physician's assistants, this isn't what pharmacy was all about. What we want to do is now, in the time from when he first started to now, it's the normal way to play basketball. What we want to do is make this the normal way of interacting in our institutions and our organizations with each other, et cetera. So have a great rest of the day. Please give this panel one more round of applause. And I'm going to bring An up, who's going to tell us what we're going to do for the rest of the day. Come on up, An. I surprised her just now, too, just so you know.
All right, thank you, everyone. And so we hope this morning session was just a little teaser of what's to come. We hope everyone sticks around for the Changemaker Summit that will be starting at 1:30 p.m. Eastern. So please hang around, network, and for folks online, you can stay on this link to come back at 1:30. There's plenty more to come. All right, thank you.